Progeria, also known as Hutchinson-Gilford syndrome, is very rare genetic disorder that causes children to age rapidly. A single gene mutation is responsible for progeria, and the gene is lamin A. It makes protein that is necessary for making nucleus stable. When this gene has a defect, an abnormal form of lamin A protein is produced, which makes cells unstable, thus leading to early aging, and that occurs around age 11 to 15.
This is Stoneman Syndrome or fibrodysplasia ossificans progressiva. This is a very rare genetic disease in which soft tissues get ossified and bones form there. This eventually leads to stiffness and limited movement of affected joints, and even trouble eating and speaking. Finally, it can lead to complete immobilization.
Porphyria cutanea tarda is a rare blood disorder that affects the skin, and its symptoms include painful blistering skin lesions. They develop when the skin is exposed to the sun, so that is why it is called vampire disease. Because people with this condition usually experience symptoms only after exposure to sunlight.
Topical Sprue, as the name suggests, occurs to people in tropics or travelers that travel to tropical regions. Exact causative factor is unknown, but it starts with an intestinal infection. The infection causes enterocyte injury. Enterocytes are your cells of intestine, intestinal stasis, and also bacterial overgrowth. The symptoms of tropical sprue are acute or chronic diarrhea, weight loss, and malabsorption. This is chromohidrosis. In this condition, sweat glands make too much lipofuscin, or lipofuscin is chemically different from normal. It has no permanent treatment, and patients can buy drugs empty the glands to achieve a sweat-free period of about 48 to 72 hours. Hematidrosis or hematohidrosis is a very rare medical condition that causes you to sweat blood from your skin. It is due to breakage of tiny vessels in the skin, and it may be related to high blood pressure or bleeding disorders. Sometimes it is even seen in distress and fear. Treatment is based upon the trigger of hematidrosis. In this rare disease, there is absence of fingernails or toenails. It is not deadly, but mainly a cosmetic problem. So the treatment involves prosthetic acrylic nails for cosmesis or reassurance with no treatment. This is Alkaptonuria. It is a rare inherited disorder. In this disease, urine is black because the body does not fully break amino acids, tyrosine and phenylalanine, which results in a buildup of a chemical called homogenistic acid. People with this condition have normal life expectancy. This is peeling skin syndrome, characterized by superficial, painless peeling and blistering of skin. This is a genetic disease, and there are two forms of it. In generalized form, there is involvement of whole body, and in the acral form, there is involvement of hands and feet only. These are prions. Prions are type of protein that can cause normal protein in the brain to fold abnormally. These abnormal protein in the brain causes memory impairment, personality changes, and difficulties with movement. The source of the disease is brain infected with prions. Though rare, they are 100% fatal and cannot be cured.